Now we're going to talk about each segment of the spine. First of all, the cervical spine, which corresponds to the neck. Okay? Here are two models of different problems in the spine. The left one, this one, it's a normal C spine. We have 7 cervical vertebrae. Between each 2 vertebrae, it's the disc here. And between each 2 vertebrae, we also have the vertebral hole where the nerve roots exit the spinal canal here. You can see the nerves here. And in the cervical region, we have it very close to the arterial, to the vertebral artery, okay? The vertebral artery goes through the bone in the cervical area, from C6, the 6th cervical vertebra, till the second one when it leaves the vertebra and goes into the cranium, okay? So this is the cervical area. In this model, we can see the deformity that has happened with the pass of time. When you get older, over the time, we can get deformity of the vertebra. We can have the wear out of the discs, and the disc becomes narrower, and the bone starts to deform and develop what we call bone spurs or osteophytes. When those deformity can cause the narrowing of the spinal canal by itself, or also the narrowing of the foramen where the nerve roots exit, causing the compression of the nerve. And in the cervical area, you can have neck pain and also pain which irradiates from the base of the cranium to the neck, shoulder, and arms. You can also feel tingling, numbness of the hands, and the loss of strength in the very severe cases. When there are severe cases of narrowing of the spinal canal, you can have compression of the spinal cord, and that can cause weakness of 4 extremities, also your legs and your arms.